I'm Dr. Dwight Jennings. Here at our clinic, Northern California Craniofacial Center, we treat a wide variety of medical conditions through jaw orthopedics. In particular today we're going to be talking about Parkinson's and how Parkinson's is related to jaw alignment dysfunction. Most of our Parkinson's patients, when they present, their jaw joint is compressed too far back in the skull, as illustrated by this model. Normally you would like the whole lower jaw to be more forward and this space be larger than this space here in the front, where the little disc fits between the jaw and the skull. The other primary characteristic that we find on Parkinson patients is that they're all agape. Their jaw falls too far away from their upper teeth in rest. And so they're slightly agape. Oftentimes that'll make their voice sound a little bit more hollow or a little bit of lisp in their voice. But you like when the teeth bite down, that there be adequate space back here. And these days we find a number of cases where the jaw is just too far back. There are a number of reasons why jaw alignment has a major influence on Parkinson's symptoms. With regard to rigidity, the Japanese have done 35 years of research showing that any time the teeth are shortened on one side of the body, it induces an increased hypertonicity in the muscles on the opposite side of the body. So there's very strong, compelling evidence that rigidity can be induced with the bite being off. Another main symptom you find in 70% of Parkinson's patients is that they have an abnormal blink reflex. Blink reflex is modulated by your trigeminal nerve, which controls your jaw muscles. The sensory from your trigeminal going in and affecting the seventh facial nerve coming out to cause the eyes to blink. With bite dysfunction, the trigeminal sensory is disturbed in a high percentage of the cases, and that would alter blink reflex. Smell, there are two noses. There's our olfactory, which most doctors are aware of, but few are aware of is that the trigeminal nerve going to your jaw muscles also controls your chemoreceptors. And with trigeminal disturbance, you often see a shifting in smell characteristics, all the way from multiple chemical sensitivity syndromes to loss of smell. I've had many cases in which our therapy has restored smell after being missing for many years. The last and most important on Parkinson's is how the bite could possibly influence movement. They've known since 1905 that if you stimulate the reticular formation, your reptilian part of your brain down here in the lower part of the brain, that it induces tremors and Parkinsonian type movements. Research has shown is that your jaw alignment sensors, which go through your trigeminal into your trigeminal mesencephalic nucleus, sends second-order neurons into the reticular formation, and in fact they are the predominant, most populous cell within the reticular formation are second-order neurons from your jaw alignment sensors. So here we have how the bite impacts a number of the Parkinsonian symptoms. Typical treatment is with a orthotic that covers up the teeth and fills up that agapeness and restores the jaw alignment through positioning the bite in a particular position. Thank you very much.